Hi, everyone. This is Dr. Cliff Faver here, and just going to talk this week about two of the medications or drugs that we see the veterinarians prescribe a lot for allergies. And I think it's kind of fun, if nothing else, to understand how they work. What we find is when we get allergies is we get a response, and that response is in the form of a cytokine. A cytokine is basically, I always call it the town gossip, but it's basically a product that floats around in the body and goes into cells and gets everybody excited. So it's a town gossip. It's going around telling the story, hey, bad things are coming, you better be prepared. And so it gets into these cells, creating that inflammatory response. Now, how our drugs work is to block that. Now, when we talk about something like steroids, even cyclosporin, they're pretty broad. They cover a lot of different things. And that's part of the reason why we talk about it suppresses the immune system. So if it blocks all these cells, then if we have cancer coming along or we've got infection there, it may block our response to that. And so therefore we have a greater chance of having an issue on it. So we want to block the inflammation, the allergy, but we really don't want to just block it completely. So we've gotten a little more sophisticated with our being able to treat that. So we come along with drugs like Apoquel. Now, how Apoquel works is basically those cytokines go through, let's call it a door. I like to keep it simple. It goes through a door to get into the cell. How Apoquel works is it closes the door. So now the cytokine can't get into the cell, can't go in and create that inflammatory response, and so it blocks it by doing that. Now, we have to keep closing the door because of the fact if we don't keep it closed, then we're going to go back into the same thing. And that's why we have to give drugs like cytokine or like Apoquel and steroids and cyclosporin on a regular basis. We can't just give one and it's good for a long period of time on that because they're just blocking the response. Now, if we look at something like Cytopoint, it's got a little different effect on that. So we've got these cytokines floating around, and what Cytopoint is a monoclonal antibody. So what it is the big thug comes along and grabs the cytokine and hangs on to it. Now they're too fat to get through the door. And so now they can't get through the door, and now that cytokine is out of commission. It can't sneak in because it's, the big thugs got a hold of it and not let go on that. So that's where we can use that, and it lasts a little bit longer. So a lot of your recommendations on your Cytopoint injections are once a month because it will block that. Now, I always say, it seems kind of backwards to me that we wait until we get an inflammation and a problem, and then we try to block it. Almost looks like we got the cart in front of the horse. The reality is, if we create a good skin barrier, we block the whole process. We don't allow it to get to the inflammatory response. And that's why when I talk in my class that we can prevent most skin problems, by creating a good skin barrier and having that good sebum there, then we never get to the skin to cause the inflammation, which causes the problem. So that's where using the right shampoo, the right conditioner, and the key point's conditioner to create that skin barrier is going to prevent the vast majority of your problems. Hope that helps. We'll see you next week.